All right. Good afternoon, everyone. Welcome, welcome. Thank you so much for all of you for coming today. We are Pinnacle Financial Services presenting a very brief intro, very basic intro to ACA 101. My name is Dave Gunas. I am the newest team member here at Pinnacle. I am the only ACA sales director so far. You could always email me. I'll give you my contact info at the end if you have any questions or concerns. And the other thing is that everyone for now is on listen-only mode. We're going to save questions, or you could pop questions in at any time during the whole hour here, if we take that long, in the chat, and I will get to all of it towards the end. All right. So, Affordable Care Act, the first one, or otherwise known as Obamacare, right? Enacted to increase healthcare accessibility and affordability for individuals and small businesses. Provides financial assistance through subsidies and premium tax credits based on income, based on your household income. Okay. So a basic timeline here, 2006, right? Everybody, I think most people are familiar with 2010, right? That is when it actually came into law. But 2006, Massachusetts actually created the first framework for them to create the nationwide expansion in 2010. So Massachusetts, the governor there was Mitt Romney. It was actually called Romney Care in Massachusetts for that year. And then Obama administration began shaping it up for national reform, 2007, 2009. 2010 actually becomes a law, signed into law. 2013, health insurance marketplace is created. So allowing individuals and small businesses to purchase affordable healthcare coverage. After 2013, that's really the end of our timeline here, because again, this is just a basic intro, but various amendments almost every year or so, including Medicaid expansion, for some states, and increased subsidies under the American Rescue Plan a couple of years ago. So the primary goal of ACA, the reason it was enacted was to just expand access to for those who would otherwise be unable to afford private insurance, but do not qualify also for Medicaid based on their income, right? So it's kind of like the middle of the pack, right? So anyone making below the federal poverty level would be qualified for Medicaid, where it's basically, almost free insurance, right? So no copays or anything like that. And then there was private insurance that could have been too much to afford for many, many Americans, millions of Americans. So they were focusing on the middle of the pack, but they didn't make enough money to afford a private plan, but didn't make too little also for Medicaid. So how it comes through is with premium tax credits. Those are provided by the government, the federal government, right? For people between 100 and 400% of the federal poverty level to reduce costs, okay? Medicaid expansion is a big part of it. Eligibility for Medicaid varies by state. Some states expanded Medicaid eligibility to cover more low-income individuals, and we'll get into the levels, the poverty levels, and what they qualify for, which does vary with some states that did the Medicaid expansion and those that didn't. We can get into that in a future webinar too. There's a lot of detail there. So also private insurance subsidies, like I mentioned, right? Plans are offered by private insurers with premiums partially covered by federal subsidies based on their household income. So the carriers are getting their full premiums, but they're being subsidized by the government. So either the consumer is paying something, or sometimes a $0 premium, and the government's taking care of the rest, again, based on income. So we can talk about this towards the end too, if anybody has questions. I know it looks like a lot, but this is basically the federal poverty levels, 24 and 25. They might have. This is the official guidelines for 2025. So just basically, someone's making $15,000, right? Under $15,060. That's pretty much they'd be qualified for Medicaid, and whatever enrollment platform you're trying to enroll them on will tell you that right away. So then it gives you some links and offers a way to get them to apply for Medicaid. But now let's say they're at minimum 15,060 to anywhere all the way up to 400% of FPL, 60,000, right? What that means is, and again, the amount of people in the household, the tax household, are on the left there. What that means is the lower the income, as long as they meet that minimum, they could possibly get a $0 premium, or they can get, they still may pay for it if they're making enough money, but they can still get a plan on the Affordable Care Act. The demographic the ACA is mostly focused on, of course, is that middle of the pack, a lower income demographic. So they are going to be closer to the lower income amounts. And then as household members increase, then the numbers can change, their premiums might change, but that's how it gets determined. Okay, the minimum requirements. So to be eligible for a plan, to be eligible on the Affordable Care Act, a QHP, a Qualified Health Plan, they came up with what was called the 10 Essential Health Benefits. Plans that are not on the ACA are not absolutely required to have these. If they're on the ACA, though, they absolutely are required to have these 10 things. Hospitalizations, ambulatory services, that includes doctor visits, routine care, emergency services, maternity and newborn care, mental health and substance use treatment, prescription drugs, lab services, preventive and wellness services, pediatric dental and vision care, and rehab services and devices. Okay, every plan on the ACA must have all 10 of those. Who qualifies for ACA coverage? So, number one, U.S. citizen or lawfully present immigrant in the country. Okay, whether it's a green card or they have some kind of documentation that proves they're lawfully present, they will have to submit something like that. They are not eligible for employer-based insurance, Medicaid, or Medicare unless qualifying for ACA plans. So basically, real quick on that, employer-based insurance, it gets a little detailed, but basically, I believe for 2025, it's 9.2%. If their employer-based coverage costs more than 9.2% of their income, then they would qualify for ACA. If it is less than that, then they have to take that employer-based coverage. Okay, we can talk about that more later, or another webinar too. There's a lot more detail there. I do suggest, because it does get a little dicey when clients ask about income, they don't all necessarily know exactly what they're making or how much of a percentage their employer-based income health coverage, would be. So when I've talked to clients with that situation, always refer them to a tax professional just to make sure. Now, household income, again, between 100 and 400% FPL for subsidies varies based on, again, those Medicaid expansion states. All right, so a lot like Medicare, right? I'm sure if you guys have been selling Medicare or ACA for a while too, qualifying life events, right? Special enrollment periods, those all apply here as well. Moving to a different state or county, zip code can change or be the same and still be in a different county. So you always want to check that out and see if they are eligible for a different plan, which would qualify them for a qualifying life event or during a special enrollment period. Loss of health coverage, right? Like they lost their job coverage, aging out of a parent's plan at 26, marriage or change in household size, becoming a U.S. citizen or a permanent resident, right? If they weren't before and they just became one, that would qualify them as well. Released from incarceration, and 60 days, any of these events have to happen within 60 days to qualify them for that QLE, okay? And you can enroll them within that time. Okay. So for you guys, what you need to sell ACA plans, okay? Number one, pretty obvious, you need your life and health insurance license. Primarily your resident state, if that's the only state you want to sell in, great. But also, just like Medicare, any non-resident states that you plan to sell. So get those licenses first. and you have to have those to be eligible to sell in any of those states. Then CMS.gov. Most of you probably have an account. If not, you create one. You simply have to take the FFM, the Federally Facilitated Marketplace Training and Certification, which is completely free. It takes only a few hours if you're brand new to it, even quicker when you take it over and over again. So very easy. So that is all you need to sell through an enrollment site like healthcare.gov or something like Health Sherpa, which we'll talk about in a minute. So direct enrollment access sells in about 30 states via, like I said, healthcare.gov or an EDE, an enhanced direct enrollment platform like Health Sherpa. Health Sherpa, I'm almost positive, is pretty much the largest enrollment platform besides healthcare.gov, so widely used. 20 states have their own private marketplaces, though. So that's as of 2025. More and more states were on the federal exchange and went private. Bunch of reasons for that. We can get into that another time. But that bottom point there, the benefits, more regulations, but also higher client retention in these private exchanges because the consumers often renew with the same agent. So for those private-based exchanges, the private state exchanges, you must individually certify for each and every one of them. Process can take a bit. So I myself have signed up for a bunch of them. Pennsylvania, for instance, where I'm here today in Philly, pretty gray and rainy actually, so I hope it's nicer where you guys are at. But Penny is the Pennsylvania State Exchange. That took, I won't say 3 weeks, but at least 2 to get the final approval. So they do take some time. They're all separate certifications. Most of those private exchanges do have longer trainings and certifications than that FFM one that I just mentioned on CMS.gov. That's a pretty quick one. These can take a while. New York, for instance, had about over 11 modules, but with over 1,100 slides, things you have to look at and answer questions. Testing at the end. Some states give you unlimited chances to pass. Some states only give you 2 chances to pass. So you definitely want to take those trainings pretty seriously and focus on those. So, but once you take a few, they're all pretty similar. Slightly different regulations in different states. Okay, so keep that in mind. All right. So basically, understanding ACA eligibility and subsidies to better serve clients. Get certified on CMS.gov and state-based exchanges. Use enhanced direct enrollment EDE platforms like Health Sherpa, which we highly recommend for streamlined enrollments, and be proactive in assisting clients with renewals and qualifying life events. All right, so I see one question right now. I can't pull up the actual whole list, but right now I see, I mentioned SEPs. What's the normal enrollment period? So, great question. Open enrollment, right, that will go from November 1st in every state. And then the end date actually depends on the state. Most states will go to December 31st or December 15th. Some states do go to December 31st to have an effectuation date of January 1st. Other states go to January 15th, but not for a January effective date, but for a February 1st effective date. Some states, like New York, actually go to January 31st, today. So open enrollment for New York, say, is open still right now. And people are still actively enrolling for a February 1st start date. I did get one question here, some compliance issues. Okay, I do want to say something about ACA. So I'm sure most of you know, as far as regulations go, it's getting better. It's gotten way, way better for sure. But it pretty much still is the wild, wild west compared to Medicare, right? So a couple of things that in my other jobs that I've had selling and managing teams that were selling ACA, A lot of agents, a major issue with CMS.gov, with CMS rather, is stating that because the demographic that we're looking at here, that we're writing policies for, are mostly $0 premium plans. A lot of agents take that to mean, or take that to advise the consumer to make it sound better, that it's free. Nothing is free. Make sure that whoever's selling or writing these policies do not mention the word free, okay? Even if it's a $0 premium. You could absolutely say this is a $0 monthly premium plan, but nothing is free, right? Because there's copays, there's deductibles possibly, there's always could be costs involved. So just that's one thing for certain, just keep the word free out of your pitch. So we got a question about income, okay? So we can go back to the income chart. When you're calculating income for the client, it is the tax household, okay? So whether or not they're getting insurance or the family member is being covered on the plan, say it's just a husband and wife, the wife calls in, she's the primary policyholder, she gets the ACA plan. When you put their income in, you have to include the husband's. Even though he's not getting coverage, his income still is included in the tax household. So that's what you use for this, like as it applies to the FPL chart here. There's a bunch of different allowable income sources, and there's some that aren't. I do not have them memorized, but I know for sure 100% that something like child support does not count towards income. So that's something that you wouldn't have to involve in their income report. Most other things are, though. So I can get you the resources as well. CMS.gov is a great resource, simple search bar, and there is so much information on there. Just to put allowable income sources, anything in there, and you'll find the answers. And I could definitely get them for you too. So, so it all depends. So this question, I think the most important thing is taxes. Taxes are what drive this process, okay? One of the drivers, at least, of determining their income and what kind of premium subsidies they're eligible for. So they cannot be a dependent on anybody else's taxes, right? So the primary policyholder is on their taxes, it's her and her husband, so you're including both their incomes. If there's a child in the house over 26, under 26, and they're working, that's also included in the tax household income. So it's all about taxes. It's who they include on their tax household. If a family or a married couple is, let's say only one of them is applying for coverage, they must still file jointly when they file their taxes, and that is something you can advise them of. Okay, any fees for the certifications? Again, the FFM, there are none, as I'm thinking. So there for CMS.gov, FFM, there are no fees, completely free. And for the state-based exchanges, the ones that I've done, I know for sure there were no fees at all. Contracting and appointing with the carriers, sometimes there's fees there, sometimes not. But for the certifications, no. Okay, I have a question here. Do you have to take the FFM certification and the local state certifications, or is it just one or the other? So to sell on like what we recommend, Health Sherpa, you must take the FFM, and that's it. That's all you need. You have to have that state license in whatever state, in any of those 30 states that you want to sell in, and you are ready to sell on, and again, of course, besides contracting and appointing with the carriers, but you are certified to sell on Health Sherpa, healthcare.gov, via healthcare.gov, right? So you don't have to take the state exchanges if you don't want. The benefits of the state exchanges are just a little, like I said, a few tighter regulations, and they tend to stay on the books a little bit better than they do on the federal exchange. So you don't have to take both, but you have to take whatever state you want to sell in, you have to take those certifications. So another question here, for the states that use the federal exchange, of course, what I was talking about today was just certifying to sell on the state-based platforms or the federal platform, right? The exchange. But if you want to sell Anthem in Florida, well, that's Florida Blue. That's actually a different monster. For Florida Blue, you have to live in Florida. Besides that, though, any other state, if you want to sell Anthem in Ohio, say, you do, of course, have to get appointed and contracted with with Anthem in Ohio. So you do. That is definitely a whole other part of this. Today was just about what you need to sell on the exchanges. Yeah, so, okay, I see a few more questions here about certifying with the companies. That's, again, a whole other monster, contracting and appointing, which Pinnacle here, financial services, we can definitely help you out with. But yes, just like Medicare, you have to get contracted and appointed with carriers to be able to sell their policies. So that goes for, Medicare, ACA, both. Okay, that's my contact information. PFSinsurance.com is a great resource for you. And we could look at the website right now real quick for a few things. But okay, I'm just reading a question here. If someone misses open enrollment and files a tax return in April for less income than the prior year, which qualified for ACA, do they have to wait till next open enrollment, or can they enroll during lock-in? Okay, so real quick on this. This could be a whole nother webinar. But as far as taxes go, there's, so through Health Sherpa, let's say, all the verifications and the disclaimers are going to be toward the end of the application. We can do a whole other webinar on just doing an application in Sherpa. There's a lot of ins and outs to that as well. But towards the end, you're going to have your disclaimers. One of them is informing the client that these tax subsidies, right, these advanced premium tax credits, absolutely have implications on your tax return. So when a client is enrolled for an ACA plan, what they get for tax season is what's called a 1095. So they have to submit that to their tax professional. That is what is going to say how much they received in credits for having an ACA plan, and it's going to affect their tax return. So, excuse me. So, for instance, if someone reports on the phone that they're within the poverty limits that we talked about before, right? They're right on target to get a $0 premium. They're at $22,000. They tell you is a fair approximation for the year. At the end of the year, they end up making $70,000, $80,000. Depending on the percentages and how much they actually made above what they told you they were going to make, they're going to have to pay back those credits, or at least in some states, tax penalties will apply. So if they tell you they're going to make 50 this year, and they end up only making 20 or 30, they actually get more of a credit in their tax return. So I hope that makes sense. But again, that is a bigger issue too, and we can talk about that in a whole another webinar if we can. It's been great. This was my first webinar ever, so I really appreciate all of you coming, listening. Everybody will get the presentation here. Again, I hope this was helpful. Very brief intro, ACA 101, right? So if anybody has any questions, any concerns, anything at all, that is my contact info. You can let me know if you have any ideas for future webinars that you'd like to learn more about, and we can definitely collaborate and do something like that. Let me see. So again, pfsinsurance.com, awesome resource for everybody. Oh, this is a good one. I'm sorry, I missed this question. What is the process through Pinnacle for beginning to sell ACA? So pfsinsurance.com/spot, S-P-O-T, pfsinsurance.com/spot. That is where you're going to sign or fill out your first inquiry form, basically registration form for us. Get that into us, and we will get back to you with next steps. As far as Pinnacle goes, guys, awesome company. I started here a couple of months ago. We can really provide a ton of benefits for all of you, whether you're an independent agent, you have some downline agents, anything, any of your needs. We can help you with a website, a logo, contribute marketing dollars. We have tons and tons of services. We're a national FMO. We work in every state. Medicare has been the company's bread and butter for 25 years, I believe. And now we're just getting into ACA. So we look forward to growing, and more of you can come on board. Would love to answer any other questions you guys have. And I'm available anytime. Email me, call me, whatever you need. But I think that's about it, guys. I really appreciate everybody coming today. Thank you so much. Let me know if you guys need anything. Have a great day, guys. Have a great weekend. Bye-bye.
Don't forget to subscribe to catch the latest news in insurance and agent training. See you in the next video.